Hello everyone. Today we'll discuss about the ear part 1. In this part 1 we'll discuss about the external ear and the tympanic membrane. Now first of all, the external ear basically consists of two main parts, that is the auricle or the pinna and the external acoustic meatus. Now first of all, the auricle or the pinna. The auricle is a part seen on the surface. The greater part of it is made up of a single crumpled plate of elastic cartilage which is lined on both sides by the skin. Now it basically supports the spectacles. However, the lowest part of the auricle is soft and consists of only of the fibrofatty tissue covered by the skin. And this part is known as the lobule for wearing the earrings in your ear, right? Whatever part that you wear the earring is the lobule part. But the rest of the auricle is divided into a number of parts. These are basically the helix, antihelix, concha, tragus, and the scaphoid fossa. In particular, note the large depression called the concha. It leads into the external acoustic meatus. So the large depression over here is known as the concha, as you can see in this figure. In relation to the auricle, there are a number of muscles. These are all vestigial in the men. In lower animals, the intrinsic and the extrinsic muscle are basically present. The intrinsic muscle are the muscle alter the shape of the auricle, while the extrinsic muscle actually move the auricle as a whole. Now next is the nerve supply of the pinna. The upper 2/3 of the lateral surface of the auricle is supplied by the auriculotemporal nerve and the lower 1/3 by the greater auricular nerve. The upper 2/3 of the medial surface are supplied by the lesser occipital nerve. Basically the root of the auricle is supplied by the auricular branch of the vagus nerve, and the auricular muscle are basically supplied through the branches of the facial nerve. Now next is about the blood supply of the pinna. The blood supply of the auricle is derived from the posterior auricular and the superficial temporal arteries. The lymphatics are basically drained into the preauricular and the postauricular lymph nodes. Now next is about the external acoustic meatus. The external acoustic meatus or the external auditory meatus is actually conducts the sound waves from the concha to the tympanic membrane. Remember, from the concha to the tympanic membrane. The canal is actually S-shaped, as you can see in this diagram. Its outer part is directed medially forward and upwards. The middle part is actually directed medially backward and upward. The inner part is actually directed medially forward and downwards. The meatus can be straightened for examination by pulling the auricle upward, backward, and slightly laterally. The meatus or the canal is about 24 mm long, of which the medial 2/3 or the 16 mm is bony part. As you can see, the 16 mm is bony part, and the lateral 1/3 8 mm is cartilaginous part. Now due to the obliquity of the tympanic membrane, the anterior wall and the floor are longer than the posterior wall and the roof. The canal is actually oval in shape in section. The greatest diameter is vertical at the lateral end and the anteroposterior at the medial end. The bony part is actually narrower than the cartilaginous part. The narrowest point, the isthmus, lies about 5 mm from the tympanic membrane. The bony part is actually formed by a tympanic plate of the temporal bone, which is actually C-shaped in cross section. The postero-superior part of the plate is actually deficient. Here the wall of the meatus is formed by a part of the squamous temporal bone. The meatus is actually lined by thin skin firmly adherent to the periosteum. The cartilaginous part, that is the 8 mm one, okay, is also C-shaped in section, and the gap of the C is actually filled with the fibrous tissue. The lining skin is adherent to the perichondrium and contains hair, sebaceous glands, and ceruminous or the wax glands. Ceruminous glands are basically modified sweat glands. The next is the blood supply of the external acoustic meatus. The outer part of the canal is actually supplied by the superficial temporal and the posterior auricular arteries, and the inner part by the deep auricular branch of the maxillary artery. Now lymphatics over here, the lymphatics are basically passed to the preauricular, postauricular, and the superficial cervical lymph nodes. Now about the nerve supply. The skin lining the anterior half of the meatus is supplied by the auriculotemporal nerve. Frequently asked MCQ that the skin lining the anterior half of the meatus is supplied by the auriculotemporal nerve, and that line the posterior half is actually supplied by the auricular branch of the vagus nerve. Now very important thing is the tympanic membrane. Now this is actually a thin translucent partition between the external acoustic meatus and the middle ear. It forms a lateral wall of the middle ear. It is actually oval in shape, measuring about 9 by 10 mm. It is placed obliquely at an angle of 55 degrees with the floor of the meatus. It faces actually downwards, forwards and laterally. The membrane has outer and the inner surfaces. The outer surface of the membrane is actually lined by thin skin and it is concave. The inner surface provides attachment to the handle of the malleus, which extends up to its center. The inner surface is actually convex. Remember, the outer one is the concave and the inner one is the convex one. The point of the maximum convexity lies at the tip of the handle of the malleus and is known as the umbo. The membrane is actually thickened at its circumference, which is fixed to the tympanic sulcus of the temporal bone on the tympanic plate. Superiorly, the sulcus is actually deficient. Here, the membrane is actually attached to the tympanic notch. From the ends of the notch, two bends, the anterior and the posterior malleolar folds, are actually prolonged to the lateral process of the malleus, while the greater part of the tympanic membrane is tightly stretched and is therefore known as the pars tensa. The part between the two malleolar folds is loose and is known as the pars flaccida. The pars flaccida is actually crossed internally by the chord tympani. This part is more liable to rupture than the pars tensa. Remember, the chord tympani part, the pars flaccida, is crossed internally by the chord tympani part. And remember, this part is actually more liable to rupture than the pars tensa. The membrane is actually held tense by the inward pull of the tensor tympani muscle, which is actually inserted into the upper end of the handle of the malleus. Now, very important structure of the tympanic membrane or the eardrum. Now, tympanic membrane is actually composed of the following three layers, that is the outer cuticular layer of the skin, the middle fibrous layer, and the last one is basically the inner mucous layer. Now, first of all, the outer cuticular layer is actually the skin layer. Okay, the skin layer is the outer cuticular layer. The middle fibrous layer is actually made up of superficial radiating fibers and deep circular fibers. The circular fibers are minimal at the center and maximal at the periphery. The fibrous layer is actually replaced by loose areolar tissue in the pars flaccida. The inner mucous layer is actually lined by a low ciliated columnar epithelium. Now, next is the blood supply of the tympanic membrane. Now, the outer surface is actually supplied by the deep auricular branch of the maxillary artery, and the inner surface is actually supplied by the anterior tympanic branch of the maxillary artery, and also by the posterior tympanic branch of the stylomastoid branch of the posterior auricular artery. About the venous drainage, the veins from the outer surface drain into the external jugular vein. Those from the inner surface drain into the transverse sinus and into the venous plexus around the auditory tube. Now, over here the lymphatics passes to the preauricular and the retropharyngeal lymph nodes. Now, next is about the nerve supply over here, the outer surface and the inner surface, right? So, over here the outer surface, the anteroinferior part is basically supplied by the auriculotemporal nerve, and the posterior-inferior part of the outer surface is supplied by the auricular branch of the vagus nerve with a communicating branch from the facial nerve. The inferior surface is basically supplied by the tympanic branch of the glossopharyngeal nerve through the tympanic plexus. Now, over here, remember, the auricular branch is also known as the Arnold's nerve, and the tympanic branch, okay, is also known as of the glossopharyngeal nerve is also known as the Jacobson nerve. Now, the very important applied aspect of the external ear and the tympanic membrane. Now, first of all, for examination of the external acoustic meatus and the tympanic membrane, the auricle should be drawn upwards, backwards and slightly laterally. However, in the infants, the auricle is actually drawn downwards and backwards because the canal is actually only cartilaginous and the outer surface of the tympanic membrane is directed mainly downwards. Now, next is about the infections. Boils and other infection of the external auditory meatus cause a little swelling but are extremely painful due to the fixity of the skin to the underlying bone and cartilage. Ear should be dried after head bath or swimming. Now, the irritation of the auricular branch of the vagus nerve in the external ear by ear wax or syringing may reflexly produce persistent cough known as the ear cough, vomiting or even death due to the sudden cardiac inhibition. On the other hand, mild stimulation of this nerve may reflexly produce increased appetite. Also, accumulation of the wax in the external acoustic meatus is often a source of excessive itching although fungal infection and the foreign bodies should be excluded. Troublesome impaction of the large foreign bodies like seeds, grains, insects is very common. Syringing actually done to remove all these structures or all these foreign bodies from the external acoustic meatus. Now next is about the Ramsey Hunt syndrome. Now what happens in over here? Involvement of the ear in herpes zoster of the geniculate ganglion depends on the connection between the auricular branch of the vagus nerve and the facial nerve within the petrous temporal bone. And over here we can see a classical triad, that is the ipsilateral facial paralysis, ear pin or hearing loss, and the vesicles in the pinna. Small pieces of the skin from the lobule of the pinna are commonly used for demonstration of the lepra bacilli to confirm the diagnosis of the leprosy. Also, pinna is used as grafting material. Hair on the pinna in males represent the Y-linked inheritance, a good number of ear traits for the Mendelian inheritance. Also, infection of the elastic cartilage may cause perichondritis. Now, what is cauliflower ear? Now, bleeding within the auricle occurs between the perichondrium and auricular cartilage. Now, if this thing is left untreated, fibrosis occurs as hematoma comprises blood supply to cartilage. Fibrosis leads to cauliflower ear and it is usually seen in the wrestlers. The tympanic membrane is actually divided into an upper smaller sector, the pars flaccida, bounded by the anterior and the posterior malleolar folds, and a larger sector, the pars tensa. Behind the pars flaccida lies the cord tympani. So disease in pars flaccida should be treated carefully. When the tympanic membrane actually illuminated for examination, the cavity of the membrane produces a cone of light over the antero-inferior quadrant, which is the farthest or deepest quadrant with its apex at the umbo. Through the membrane, one can see the underlying handle of the malleus and the long process of the incus. Also, the membrane is sometimes incised to drain pus present in the middle ear. The procedure is known as the myringotomy. The incision for the myringotomy is actually done or made in the postero-inferior part or the postero-inferior quadrant of the membrane where the bulge is mostly prominent. In giving an incision, it has to be remembered that the cord tympani nerve runs downwards and forwards across the inner surface of the membrane, lateral to the long processes of the incus but medial to the neck of the malleus. Now, if the nerve is injured over here, taste from most of the anterior two-thirds of the tongue is not perceived. Also, salivation from the submandibular and the sublingual glands gets affected. So right now till here, we'll discuss about the middle ear and the inner ear for the next video. I hope you understood well. Thank you so much.